I'm going to be talking about characteristics of learning environments that foster resilience. And the first one we need to talk about is providing a safe environment for children. And by safe, I mean that of course it needs to be physically safe so that children can explore materials without hurting themselves. But as importantly, it needs to be emotionally safe. So children know that mistakes are okay, that they can question and explore, and will be encouraged to do so. Along with that, in the curriculum, we also want to teach life skills. In teaching life skills, I mean that children at this age should be constructing knowledge around these in a developmentally appropriate way. And they can learn about what it means to make choices or what it means to plan. So of course, during your free play or free choice time, children are given lots of opportunities to make choices. I think it's important to look throughout the day, though, to provide other opportunities. And with planning, I think it's easy to think about preschool-age children planning for what materials they'll use during free choice. But think about also involving them in planning for a family event that you might have at the center. We also want to set clear boundaries. All children need, and even though they don't tell us this, they want limits. It's what helps keep them safe. They know they're safe if there are limits and that adults care about them. We want to set high yet achievable academic and social goals. Along with that, though, we have to provide the respect and support necessary for children to achieve those goals. Related to that is we have to provide meaningful participation. So the activities or the curriculum that we plan should be stimulating, should be interesting, and should work from children's interests and ideas.
A little earlier, Keith talked about this concept of risk factors. And traditionally, that's been the focus of most prevention programs. But there's a problem with risk. I'm sure if I were to ask all of you what the risk factors were of heart disease, you could rattle them off in quick successive order. I'd hear tobacco use, I would hear high cholesterol diets, I would hear lack of physical activity and exercise, I would hear a stressful lifestyle. And then what would we have if we had all of those risk factors? We would have someone who's already predisposed to the condition, which means it's far more likely that you will incur cardiovascular disease in your lifetime. Well, we want to focus a little differently today. We want to focus on the concept of protective factors. Protective factors try to eliminate and avoid the onset of anything negative in our lives, especially as it pertains to health and diseases or conditions that would be detrimental to our well-being. So when we talk about protective factors, we're really looking at those building blocks that we can begin developing in early childhood and then continue to develop throughout all of life that will insulate us and help make us resilient to any dangers or impeding events that come along. Educators are really well positioned to build protective factors in their role. We're able to develop caring relationships with children, to develop high expectations for them, and to include opportunities for their participation in the social environment. And also to provide boundaries and monitor. And we'll hear more about these protective factors later.
The most frequently encountered positive role model, oftentimes outside of the family, is the teacher. And I'm just kind of curious, Peg, what are some effective strategies that teachers can use to develop caring relationships, with their children?
Mm-hmm. Well, I'm glad you asked that because I want to talk about two things in relation to each other, and that is the idea of caring about children and for children, and then coupled with that understanding. Because I think that it starts with teachers having acceptance of children, communicating that to them and that they care about them and will take care of them if something happens. But children also need to know that if they have a bad day, if they're throwing blocks in the block corner and they've just really lost it, that the teacher's still going to care about them and that the teacher's going to understand and possibly say something like, I can see you're really frustrated and I understand how it feels when you get frustrated. But then, of course, move in with limit setting and problem solving. But the important part for the child is to know that they're loved no matter what they do, that the teacher's going to help them change the behavior, but they're going to accept them for who they are and care about them and understand that we all have bad days. And sometimes life's just tough, and I'm here to support you. So I think that's the consistent message that really good early childhood teachers send.